Hey guys, how you doing? Dr. Josh Matson here with Infinity Chiropractic Center. Sorry, there we go. The light behind me was a little bit bright. I'm going to talk about 3 tests that you can do to see if your child's dyslexic symptoms have anything to do with how they've developed. We see a lot of kids come in that have developmental challenges, like they have eye tracking issues. They have abnormal development of postural reflexes that are affecting how they're actually, their ability for them to track a line so that they can read, right? So for every kid, when they have to read, there's a foundation that needs to be in place. They need to have the ability to follow a line. They need to have the ability for their eyes to jump specifically to a point, and then be able to track a line. If they don't have that basic foundation, I don't care how much reading you do, they will not be able to read effectively. So I'm going to tell you 3 tests that you can do to check to see how their body has developed to make sure that they have a foundation for their eyes to actually function well. Number 1 test that you want to test are what are called postural reflexes. They're reflexes that keep your head level at all times and keep your eyes level at all times. All you have to do is have them look at your nose, be right in front of them, take their shoulders, and just tilt them side to side. What you should see is what my head is doing. It's staying perfectly level at all times. There's none of this, there's none of this. So you go side to side, make sure their head stays level, go forward, go backward. Their eyes and head should always stay level. Those are head writing reflexes, and they should do it with their eyes open and with their eyes closed. You should have those reflexes. A lot of kids with dyslexia or reading difficulties that they're coming from eye tracking dysfunctions, they don't have postural reflexes in place. Therefore, they don't have a foundation for their eyes to go off of, and they have to, every time they go like this, their eyes have to roll, and it creates instabilities in the eyes, which instabilities in the eyes means they can't track a line appropriately. Number 2, just put a dot on your finger and have them track from side to side to side. Their eyes should be perfectly smooth. You shouldn't see any starts and stops, like tick, tick, tick. You shouldn't see any of that. It should be nice and smooth and tracking appropriately. And that means that they can actually follow along a line without these big skips and jumps and their eyes going all over the place. The other thing that they need to be able to do is what's called convergence. They need to be able to look at a dot, and you bring it into their nose just like this. And they should be able to follow it all the way in. It should be smooth going in. It should be smooth going out. If you see their eyes are coming in and then all of a sudden one eye starts to drift off, or they say, oh, I see 2, or just ask them, do you see 1 dot? Do you see 1 dot? And if they say, no, I don't see 1 dot, they have a convergence issue. They can't bring their eyes in. Those are probably the 3 most common things that you find in kids that have a diagnosis of dyslexia. But what we find is a lot of times when you help them to develop those skills, they can therefore track a line. They can converge their eyes on a line. They have a good, solid foundation underneath their eyes. That means they can read and read and read, and it becomes a lot easier for them. And a lot of their dyslexic symptoms go away because it's actually, in some cases, it's an eye tracking issue that creates the problem in the first place. So I hope this helps you guys. Test these on your own kids if you have them, or test them on a friend's kid, or tell them about them, or send this video to someone that has dyslexia and see if they have these issues themselves. If they do, their dyslexic symptoms can get much, much, much better extremely quickly, and they can start to read better fast. So it's awesome. Have a good day, guys.